So I will go ahead and get started. And I just want to welcome everyone to this edition of the IAH Zoom Talks. And we're happy to welcome today Neil Prose and Ray Barfield, both of Duke University. We've been talking about doing a screening of this film and a conversation at IAH for a little while. And like everything else, it's now been moved online. So we're excited to welcome them today for this conversation. Let me tell you briefly a little bit about what we're trying to do with the Zoom talks and a little bit of kind of etiquette around the talks, and then we'll go straight into the film screening and then the conversation. Our goal, as many of you know at IAH, is to have great conversations around important topics fueled by or in the fields of the arts and humanities. And so this is part of that goal, to keep those great conversations happening even in the context of physical distancing, where we're not able to actually be with one another. So the Zoom talks have been going on for several weeks now. We have a couple more coming up in the coming weeks, including next week we have Jane Thrailkill of UNC Chapel Hill, who'll be talking about aging in the concept of aging in the pandemic times. So we're looking forward to that next week, and we'll be announcing some others soon as well. Our preference, if you can, is to have your camera on so that we can come as close as possible to simulating a conversation. But if you're not able to turn your camera on, we do understand. It's no big deal. And please do keep your microphone muted unless and until you're asking a question or making a comment. What we're going to do is start by screening the film Keepers of the House, which is about the struggles of the Duke University housekeepers. That's roughly about a 15-minute film. Then Neil Prose and Ray Barfield will each say some comments about the film, about its importance in its making, and then we'll open it up for conversation. And the conversation can be questions, comments, whatever you'd like, either via the chat channel. Let me know if you'd like to ask a question or make a comment, and I'll let you in at that point. But first, welcome everyone again. Thank you. And Ebony, let's go ahead and screen the film. Wonderful. Thank you for that video, for that screening. And then Neil, let's move over to you for some comments.
Sure. Thanks so much. Sorry about oh, I have an echo now too. Sorry about the quality of the sound and the lag. It's just it's a sort of another casualty of Zoom that we have to put up with sometimes. Zoom is exhausting for lots of reasons, and now we have one more, but I'm glad you got to see the film, and it's on YouTube. Just look for Keepers of the House YouTube, and you can find it in a second, and then
yeah,
watch it.
We'll put a link to the original YouTube on our website as well.
Great, thank you. So long story short, the film began the idea of the film began about 4 years ago, when Ray and I were talking about housekeepers and the way they do provide emotional support for patients and their families, and how unrecognized it often is. And Ray had recounted a story of how one of the housekeepers had described himself saying, I don't think of myself as a housekeeper, I'm actually the keeper of the house. And that became the title of our project and our film and our research. And one thing led to another. We finally managed to make the movie and kind of launch it out into the world. So I want to say a few words about some of the thoughts that went into our motivation for the film, and especially our motivation to show the film to healthcare providers and students. And then a bit about reflecting on the film during the pandemic and what that sort of feels like, because the film was totally made and organized and filmed before the pandemic, and now we have a whole new set of ways to look at hospital housekeepers. So I think I'll just going to do a very short PowerPoint, then hand it over to Ray and to all of you. So let me see if I can get back to share screen and an IAH presentation, and that should be something you all can see, yes?
Yep.
Okay, great. So basically, one of the themes that seemed very important to us in terms of how the film is received and what impact it might have was based on some work done by sociologists and psychologists at the University of Michigan. And this is a medical anthropologist who studied, and psychologist who studied the notion of being valued and devalued at work. And they actually did focus groups and interviews with a large group of hospital housekeepers and developed an understanding of how this thing all works and came to this conclusion that the meaning of our work and the worth we feel in doing that work depends on a series of daily interactions with others. That is to say that the sense of well-being of the housekeepers depended partly on their interactions with their supervisors, but almost more on their moment-to-moment interactions with doctors and nurses and other members of the healthcare team. And then they went on to describe ways that they felt valued or denied a sense of worth or substance on the job. And the themes that came up recurrently, and also the themes that came up when we spoke to the housekeepers at Duke, was first and foremost the healthcare providers not recognizing the cleaner's presence at all, which would mean never saying hello or repeatedly neglecting to get out of the way when a housekeeper is trying to push the cart down the hall. And then other things such as actually communicating disgust or disdain, activities that make the cleaner's job more difficult, and communicating negative information to the cleaner were all things that made folks feel enormously more devalued in the job that they do. And then valuing interactions, which were much less common, included recognizing the cleaner's presence, treating the cleaner as a group member, and making their job easier, and even communicating patient information to the cleaner. So that became one of our themes. There's so many themes that could be drawn out of the film, but certainly one of them was this notion of helping healthcare providers to recognize what housekeepers are doing every day, including emotional support for patients and their families, and then showing value that they value their work and demonstrating that by acting accordingly. So that was kind of the theme that we most fixed upon in the course of presenting this film to various audiences. And then this pandemic happened, and it's been interesting to follow what's happened in the news over the last few weeks. The thing that was most conspicuous to us at the very beginning was the fact that all of the articles about saluting healthcare workers or healthcare providers seem to talk almost exclusively about doctors and nurses and almost never about anybody else. So the majority of folks who are actually providing care in the hospital, which includes cleaners, janitors, transport workers, food service workers, were never part of the recipients of all the gratitude that was being bestowed on doctors and nurses. So then articles started to appear just recently on what are the risks that are being taken by housekeepers and janitors. And then this is another development that's actually very troublesome, which is the fact that because now so many hospitals have outsourced cleaning to an independent agency, then there's no longer any connection between the hospital itself and the cleaners. They're actually working for a third party. That makes the connecting with them, especially during the pandemic, even more difficult. And then the fact that over and over there were stories in mid-April, early April, and even recently, about situations where janitors and housekeepers were not getting masks when doctors and nurses were getting masks because they were felt to be the least important, the least noticed, frankly, the most dispensable. And then finally, this article that appeared in just a couple of days ago in the Baltimore Sun, written by an environmental service worker, who talks about the fact that housekeepers are dying in hospitals throughout the United States and in fact throughout the world, and ends up by saying that essential workers are getting sick and dying as they work to keep others safe. We are scared and confused. It's time for someone to help try to protect our livelihoods, our lives and our livelihoods as well. And so this is, that's kind of at the beginning. The story is still unfolding in front of us, but it's once again a story of the people who are our most valued colleagues, really, who are unappreciated and unrecognized, and then to an extent that actually their lives and livelihoods are in danger. So I'll pass it on to Ray for his comments, and then we can open up for conversation. Ray?
Thanks. I'll just make a couple of comments, and then stop. But I one of the things, there are a couple of things that have evolved in my own sense of what's happening. In fact, even just listening to Neil talk about some recent articles underscores some things that Neil and I have spent a good bit of time talking about. And one of them is at the beginning of the project, we were really moved by the accounts. Even before we did the formal focus group and the formal interviews, and Neil and Rhonda created the film, just by accounts of meaningfulness, the way that the housekeepers would just articulate their sense of meaning in their work, and of their, even if the institution itself in its sort of tendency towards hierarchy put them lower in the hierarchy, they could give accounts of their value to the patients and the patient's value to them. And so that's what moved us. And some of the stories were just astonishing and surprising. And we realized that what the housekeepers are doing is a task that brings them into proximity to people who are suffering, who are ill, who are dying. None of us are, we're all going to be affected and moved by that. But there's also a sense of vulnerability and that has to be managed in the room, that requires a great deal of skill, a great deal of emotional intelligence, and an ability to move about the room and to do tasks that may actually, if someone walked into my room and cleaned up my bathroom, and I had just thrown up or was incontinent and accidentally like peed on the floors, I'd be embarrassed. I would be embarrassed. You come in, my hair, well, I don't have a lot of hair, but if I had to, it's all messed up. And but they have to come in and treat people at their most vulnerable place with such gentleness. And so we were deeply moved by the moral and sort of community dense quality of the work they did. So that's where I think some of the things that Neil, that you just mentioned, really underscore something that's disturbing. It's disturbing within the world of the housekeepers. It's disturbing more generally in the the people who are whose financial fragility, which means also the fragility of their access to food, access to housing, access to dignity in caring for their families, that these, for the, for any, the bottom 80-90% of America, and certainly the bottom 50% of America, how fragile this is. So that's been one thing that goes even beyond the stories and that keep us from romanticizing anything, so it's the power of their stories and their sense of the value of what they're doing, but also that counterpoint between the value of what they're doing and what is being said institutionally and in the larger culture about what they're doing. Second thing is the outsourcing, because this is something that certainly must contribute in some way to the bottom line and to efficiency and to these kinds of things. But it works against the sense of trying to build a genuine community where within the institution, we're all in this together and we all have something to contribute, because they have to march to orders that come from a group that has a different set of priorities than maybe the priority that's being built inside the team taking care of a patient. And I think that undermines a sense of belonging. They're not showing up as people who belong necessarily. They're showing up as people who are working under a set of rules that no one inside the hospital community has control over. And so we abdicate any sense of stewardship. People who are in the leadership positions have abdicated a sense of stewardship of this very delicate thing so what I worry about is that as beautiful and powerful and amazing as the stories have been, that we're not taking a good enough account of the fragility of these beautiful things, and that they can indeed be broken. They can be broken by a sense of not being a genuine part of the community. They can be broken by going from 16 rooms to 20 rooms to 30 rooms to 32 rooms, which is now how many rooms they have to be in charge of. That is a lot of rooms. If you think about spending your day on your feet cleaning 32 rooms, that is a lot. It can be broken by human exhaustion, and it can be broken by a lack of any safety net at all. That means that some of the housekeepers, and we see them, are elderly people who simply must keep doing this because there is no way for them to stop. They have no resource, no capital, nothing. So I am always, every time I see the film, I am moved by both the beauty of their stories and by the presentation that Neil and Rhonda put together. But I'm also, every time I see it and every time Neil talks about the continued investigation that he's pursuing, I am extremely worried that the beauty that we're lucky enough to witness is fragile, and that it's going to be undermined, and that this COVID crisis has brought it to a head. So I'll stop there.
Thank you both. We'll open it now for comments, questions, conversation from the floor. And folks are welcome to raise their hand in the participant section, post it to the chat if they'd like to have the floor, or just enter in.
Hi, thanks so much. I'm just entering in. Is that all right, Andy?
Perfect.
So in fact, because I'm going to have to go to another Zoom call in just a minute, but I wanted to thank you all so much. This is the most important conversation and engaging meeting that I've had in like a month and a half. So I'm really grateful, and I wish it could go on for quite some time. But what really strikes me, I work with young people who are caregivers within their families for adults and other siblings and so on. And part of what I've been grappling with is this issue of recognition, and how that becomes tied into both kind of these psychosocial dimensions of recognition and the kind of recognition of acts, or of the contributions that people make. And I'm so struck by the clarity of the message here, which is that these individuals are part of the care team, and they're filling in for elements of care that are not being taken up by other people, perhaps because of cultural gaps, perhaps because of economic, class types of relationships, assumptions about levels of education, or very clearly language, and that came across as well. And so I'm literally going to posit this question, and then I'm going to have to sign out in just a minute. But I'm curious whether there's any mileage in asserting that kind of argument, that we now have evidence that these individuals are part of the care team, that they're providing essential supports and services. And so they have to be recognized as part of that care team, and whether that could shift this dynamic. Because, certainly the concern right now is that with all kinds of efficiencies that are going to have to be undertaken, this is just going to, get into a worse situation for already precarious people who are doing so much more than what they're valued for. But most of all, thank you. It's really brilliant. I can't wait to look up more of this work.
Well, I can tell you just briefly that as a physician, I'm a pediatric oncologist, and just on a personal level, as Neil and I learned more and more about the role of the housekeepers in the lives of patients, and in just the hospital would be within days a wreck without them, an absolute wreck. And I realized that, compassionate oncologist that I am, when a patient that had been on the hospital floor for a long time died, I would pull together the nurses and the doctors, the residents, the whoever. And I was mortified to realize that I had never invited a housekeeper to a debriefing session. Even though they were there on the floor, because they each have their own unit that they cover every day. Whereas I was there when it was my inpatient time, and not. So I think the answer to your question is, on a personal level, absolutely. And one of the things Neil and I are hoping to do as we talk with, and especially Neil, I mean, Neil has been just all over getting the message out, but teaching medical students and nursing students to be mindful, to become aware in a way that that I simply wasn't. That's the first thing. And the second thing I think would be we would have to have a really long conversation. And I'd be really interested in, I mean, I know about your work, but I'd be interested in your insights as you've been advocating for people who have crucial roles, and roles that are time consuming and that require a learning curve to become good at, and that need to be excellent in order to get very important things done that people's lives and well-being depend on, and then get no recognition, no pay. So it's a similar kind of thing. And I think it's so complicated, especially with corporate models of healthcare that include things like outsourcing. It becomes very difficult when you go talk to the CEO and they're like, well, we'd love to do more, but, it's out of our hands, it's outsourced and they work by the rules of, et cetera, et cetera. I mean, so I don't have an answer to that, but I think that the question needs to hover and hang over all this. Mm-hmm.
Just, I would add, our short-term goal is to create a curriculum using this film that can be used throughout the country in medical schools and nursing schools and so forth and so on. That's our project right at the moment. Having said that, Elizabeth, I see the parallels between the kind of social justice work around carers and the needs of housekeepers. It's all like one part of one thing, as far as I can tell, in so many ways. And it's about recognition and about getting paid, for work that one does fairly. It's hard, it's everybody. I think that the biggest question for me about this pandemic is it only going to make things worse, or could it make things better? I mean, I guess that's what we're all wondering. There's like, we're furiously looking up for signs of powerful social justice movements after the 1918 pandemic to prove that it could happen. And there were some, but it could go either. There's such a danger that it could go either way. We all know what that would look like. So I think for this to actually change, it's going to, it's part of a lot of things having to change. And we have to work at every level we can to try to make it happen. But who knows?
Well, I love that. Thank you so much. And then I'll be in touch. I have to go care for some grad students now.
Okay.
And get my new dog to stop barking.
Okay.
I'll do both of those at the same time.
And the tap dancing as well.
I'll be in touch. Thank you so much.
Dude, take care. Bye-bye.
Hey.
Tommy Watson, I see you have a hand up.
Yeah, so Neil and Ray, thinking about kind of piggybacking on that last point that you're making, Neil, which is, what do you see as being potential changes, or what the changes might look like post kind of a COVID-19 world? And what are kind of the main elements that are maybe going into your curriculum that you feel like would help teach, what many people could see is, people who are going to be at the top of their field, making good money, coming from different backgrounds, experiences, at times can almost be a little bit like a fraternity, a sorority culture. And so what do you build into them to help better be mindful, as you said, Ray, about kind of the everybody who they're working with and how to bring them into the fold and to work better with the housekeeping staff?
Yeah, it's a good question. And I can just tell you, because I've been working on the curriculum for most of this morning, that it's divided into a couple of different discrete sections based on what we hope young doctors, for example, could learn and how they might change their behaviors. So part of it is just about what do the housekeepers do in the film that we hope we wish the doctors would do, which are things like paying attention to detail, generosity, expressing empathy and concern, giving emotional support. So there's a list of things that we say, this is what the housekeepers are doing. How would we be doing this? The woman who says, just listen. The average doctor interrupts in the first 11 seconds of the interview. So just listen would be like a major accomplishment. So that would be the first thing. The second thing was about this issue that we raised before about recognizing and appreciating what people are doing around us and rethinking who is the team and how do we, what can we do to involve them in because they know so much about the patients that if they were able to share with us, we would learn so much, for example. And then the last piece is just everything that we should be learning about the social determinants of health by seeing what's happening to the housekeepers. That everything we should realize about how poverty ruins people's lives, how lack of health care ruins people's lives, how worry ruins people's lives, can be learned just by talking to a housekeeper when you're walking down the hall and finding out what's going on in the world. So those are the three kind of things we're trying to address. And, it's part of a bigger, like I said before, it's certainly part of a bigger struggle. I mean, hospitals are, if you scratch the surface of any hospital's public message, there's still, for example, a private message about obstructing unionization. And, the SEIU has been the only voice for housekeepers in this country up until recently. So, it's not always going to be polite and easy to get everybody on board because there are competing interests that are for real. That's why I'm looking for the post-1918 like cataclysmic social movement to get us going.
I agree, and I think honestly, that it feels almost like every problem has to be solved in order for the first sort of problems that we encounter to be solved. And I am, after the pandemic, which also, had World War I and World War II to help, disrupt some of the financial structures that were in place, a lot of stuff happened. But I think now, this is going to require groups like this to really have sustained conversation and to look at partnerships with people who have been sort of building the foundation that's going to need to become the basis for a louder voice. And I think about Reverend William Barber, for example, and the Poor People's Campaign. Where he, along with the Racial Equity Institute, has been very, just like astonishingly articulate about the impact of the history of systemic racism in this country. But now in the Poor People's Campaign has also begun to partner with people who, by the concentration of wealth at the very top, have begun to share similar, in some ways, just a lack of capital, a lack of reserve, a lack of security, despite working full time. And so, for myself, when I look at it, I feel too small. But then when I look at something like the Poor People's Campaign, I think, okay, maybe what's needed is just strategic partnerships where we add our little voice to larger voices like Barbara's voice to try to keep pushing on this in this moment of crisis. And I totally, one of the handful of things that I agree with Timothy Geithner on is, you know, never let a good crisis go to waste, or Rahm Emanuel or whoever it was that said that. And so that was a zero answer, except to say it's going to be partnerships among people who are like, no, we cannot keep doing this.
It's incredibly helpful. In fact, kind of what I was wondering in some ways as follow-up are there any funds, entities, organizations that are doing this type of work that you feel like would be really important to support or bring into this conversation? You mentioned SEIU, the Poor People's Campaign with Reverend Barber. Any other entities we should be aware of and be more familiar with?
The Racial Equity Institute, because they tell a story that is not the story you hear in high school, and they have a theory, not just a historical grounding, but they have, like, I mean, many people in the Racial Equity Institute are very moved by the work of people like Thomas Piketty, and, you know, the sort of economic work that's profoundly critical of a dominating form of capitalism under the guise of the free market. But I think that within North Carolina, for example, they have done some amazing work. And I've talked already with groups inside the hospital about partnering with the Racial Equity Institute, so that we're not only becoming aware of things like the like the dignity inherent in the work of the housekeepers, but also being mindful of the fact that while Duke draws people from all over the country to join the faculty, the housekeeping staff comes from Durham, which has a very specific history, and it is not inconsequential. And so I think that kind of thing, people who know much more than I know, and I say, then can we please partner? Help, you know. So we're going to be doing that in the hospital. I've already got nursing managers who are interested in it. And that's not specifically with the project. I mean, Neil is the leader of this project. And these are like in a sense, side things that aren't specifically the project, but it's going to be partnerships between things like this project that Neil's leading, and then the good work that the Poor People's Campaign has done, and the good work that the Racial Equity Institute has done, and the good work that people who come from academic settings who can say something about, you know, Andrew, like the sociology behind a thing, or like Elizabeth, who can say something about her research on the completely unrecognized and unremunerated work of people inside houses who are often children, young people, teenagers, you know? So.
That's great. Thank you. I won't take up any more time. I will just make a quick mention that we've been partnering with the Racial Equity Institute at the IAH for the last 3 years. So we are very well aware and big believers in their work and their philosophy and their phases of training.
And will other folks like to jump in with questions, comments? I'd be excited to know from either or both of you all what the reception has been like of this film elsewhere. What are some of the ways that others have responded, and what kinds of audiences have seen it so far?
Yeah, well, our first showings were for the housekeepers, which were the most nerve-wracking for me, because it was like if they didn't like it, we were in trouble. And they loved it. That was a really nice moment. We showed it to several different large audiences of housekeepers way back in the fall. And since then, we've showed it to an interdisciplinary group of medical and nursing and PT students. We've shown it to a group of educators at Duke. I showed it at the Academy for Communication and Healthcare in San Diego. And it's had about almost 5,000 views on YouTube by, so people are watching it. And then the pandemic hit. So we had, for this spring, 5 or 6 different national meetings lined up to show the film. And they all were postponed. So we're just kind of on hold for the time being, working on the curriculum. Ray and I are working on an op-ed piece about the role of housekeepers during the pandemic. And we hope to kind of resume the push with the film as soon as, we can get back on airplanes and go to places with groups of people, but it's obviously going to be a while. So it's still, the film isn't going away, the issue isn't going to go away. So we're optimistic that sometime in the future we'll be able to get out there and do everything we originally intended. Other comments or questions?
Ray mentioned something in passing. He said something along the lines of for pay, or a little bit, or a very little bit of pay, or something like that. And I was intrigued to see that for a film that's obviously about the sort of conditions of work and a sort of forgotten group of workers, I don't think there was any mention of money or pay. I'm interested whether that was strategic on your part, is intentional. What led to that?
That's a really good question. And it's sort of something that I think we both agonized over at various points in time, because we know it's an issue, and we didn't want to romanticize the life of a housekeeper, making it seem like everything is great if you're making $12 an hour. How to say this? We just thought it wasn't the film we were making at that moment, and the issue we were trying to emphasize. And also, I was frankly very hesitant to take the housekeeper stories and then put them in a film about racial and about equity and social justice, because it's kind of not what they signed up for exactly, and what would happen to them in terms of their work situations. So we had to respect that in a certain way. So when I take the film out into the world, we talk about those issues. We can't, how can we not? But it's not built, it's purposefully not built into the film. But there were moments I just thought, I'm really worried about that.
Yeah, I couldn't agree more. And being mindful of, that fear plays an enormous role in corporate culture. And that is not an accident. That is by design. And so no one wants to put any housekeeper at risk, or press them into a kind of vocal, because it's just, people are expendable, and you lose your job. And so I have no idea what the answer is. It's one of the reasons why I'm very interested in partnering with groups like the Poor People's Campaign and REI, because I feel like they can do that part better than I can. And we can associate with it, but continue to advocate for the kinds of dignity that was just a basic thing that was missing, which is just people who are not even seen in the hallways, just basic respect. And that's had I think an influence on students that we've met, as they're like, of course, why can't I see? And myself, I couldn't see. I was mortified, so I don't know, Neil, what do you think?
I agree. It's all we can do is try to find those people to help push those issues, and the labor movement as well, because that's like,
yes,
that's what they know how to do.
Neil and Ray, let me say thank you on behalf of the IAH for sharing your work with us today and the conversation surrounding it. Really appreciate your being part of our Zoom talks and for the work that you're both doing. The video from this talk will appear on our website once it's been cleaned and edited and so on, and so we'll make sure that becomes available. And again, thank you so much. Our next IAH Zoom talk again features Jane Thrailkill on the concept of aging during the coronavirus pandemic. That'll be next Thursday, the 14th of May at 4 p.m. And you can find registration information on the IAH website. Thanks to our audience, and thanks Neil and Ray for presenting this talk for us today. And I hope you all have a wonderful rest of your day.
Thank you so much, Andy. Thank you.